Welcome to Fundraising Good Times. My name is Pearl Davies-Shaw. I'm the president of Saad&Shaw, and I'm your host for this episode of Fundraising Good Times. With me, I have Linda Witt. She is the Senior Associate Vice President of Development at Meharry Medical College in Nashville, Tennessee. And joining us from Wilmington, North Carolina, is Saad&Shaw team member Bob Poole, also formerly the Senior Vice President Advancement at Meharry Medical College. Welcome to you both.
Good day. Good to be with you. Yeah.
Great. Well, we're in for a fundraising good time. Unfortunately, this is the time of the COVID pandemic, and fundraising is more important than ever. I wanted to really talk with the two of you for you to just share your experience. How would fundraisers or executive directors, college presidents, what would they do? How would they reach out to donors of their organizations or colleges, institutions? Linda, can we start with you? What's been your experience?
Sure. Basically, we have tried to do more communicating than ever with our donors. We share with them how their support continues to help us as we go through this pandemic. Meharry is in a unique role because we are on the front line. We are leading the front line of this pandemic. And so much of what we do right now evolves around the pandemic. And we also pretty much let our priority donors know what's going on a very regular basis, because you keep them engaged, let them know that we empathize with where they are now, especially our alumni, where many of our dentists are unable to practice right now. So we want to show empathy. And so what the first thing that we did when this pandemic came about, we reached out to our priority donors and just talked with them and let them talk to us, and let them know that we were not just in calling them for contributions at that time, but just a wellness check. And so a lot of it is we talk to them, we email them, we send them information showing what Meharry is doing on the front lines, just to let them know that Meharry is still viable. There's a lot of added value right now because what we're doing, we've been doing since 1876. It's just at a heightened level right now.
Thanks, Linda. Bob, what about you? What are you finding, or what are your suggestions?
Well, I'm not an active practitioner like Linda is anymore, and I have to say at the outset that Linda is superb at what she does. Her long-standing relationships with donors continues to pay off for Meharry because she is able, and her team, they're able to talk to people, and the people will receive their calls and their other communication because they have established long-standing relationships. So my advice to anyone trying to fundraise during this particularly difficult time is to go back to what you know in terms of your people that you're reaching out to. And that means basically knowing who they are and where they are in their lives. And so they're not just a number, they're not just a name on a piece of paper. These are real people that have real struggles like everyone else. Some are having many challenges. Many have lost financially during this time. Some may be doing okay. But I like what Linda said about the wellness check. That's very important. You hear that in context of, people checking on neighbors and that kind of thing. But a wellness check for your donors, that is really very important. And I think Meharry does an excellent job in maintaining those relationships by having these wellness checks. So my only advice is to reach out to people as people. don't just think about what you can get from them.
Right.
Think more about what it is you can offer to them at this time. It may just be a kind word. It may just be understanding. So those are the things I think at this time, these human relationships are paramount.
Bob, this is great. And I know that's when we were talking about having this discussion, you said, oh, we got to bring Linda in. And you just shared how, you know, she has such a long history of working with alumni, working with donors, and like you said, having those relationships. And
Right.
I think, you know, people say that, oh, fundraising, it's all about relationships. What does that mean? And I think, Linda, you've been sharing it, that it means that you have a connection. You're not
Right.
calling someone as an ATM. You know, you exist in relationship. And that brought me, there was something you brought up. I thought maybe you could share this story with our listeners about one of the donors you're in relationship with who'd made a major pledge and then needed to make some changes. So do you want to share that story? I think it's a great example.
Well, I think it's a great example of Meharryans, period. But one of my donors had made a commitment to get to a certain level by June 30th of this year. We've been working on this for quite some time. And a month or so ago, he called me and was very apologetic because he did not know if he was going to be able to make that goal at the commitment that he promised by the date. And of course, I told him we completely understand. And we know that when things get better for him, we can depend on him. And we kept talking, and he said, listen, find out how much I owe to get to that point and get back with me. So of course I did due diligence and checked and got back with him. And he said, you know what? I've lost some considerable money in the stock market, but this is what I want to do. I'm going to get with my wife and see if I can borrow the money from her out of her savings account, and then I will repay her. But I would love to make that the commitment that I made to Meharry. I want to honor it, and I know that Meharry needs the money. And so these are the type people that I am blessed to work with every day. These did not start out like this. We have worked together over the years, and everything has not been rosy. We've learned as we've gone along, but I cannot overemphasize how important it is to stay in tune with your donors. And I was thinking, Pearl, everyone is not going to be in the position that I'm in. I've been at Meharry 23 years. And so you may ask, how do you start these relationships? One thing that came to mind for me is looking at the data, looking at your donor base, and looking to see those individuals who have consistently supported you over the years. A lot of times they're saying, hey, I'm here, come talk to me. I may have more for you. So if someone's been consistently supporting you over the years, they would be a prime prospect to make as one of your priority prospects or donors if they are not currently.
Oh, that's great. Great. Bob, you want to add to that? I thought this is a nice point to pivot, talking about how people are working today, but then importantly, like I said, if you don't know who your priorities are, priority donors are, how do you call people?
Yeah, the question is always, where do you start? And I think Linda just pointed that out very, very well. She's been doing this for quite a while, but one of the things, you got to start somewhere. So people will think maybe, well, I need to find out who our major donors are in terms of dollar amount. Yes, that's very important. But it's also important to look at your donor base and your records to see how many people have been giving consistently over time. It could be $100 gift a year. Linda had a donor once, I recall, before I retired, that had been given $100 a year. Nobody really paid attention to that probably, but that donor wound up giving Meharry, because of Linda's continued communication, over $2 million in their estate plan. So you never know, and it goes back to the point she made so well, that you got to keep communicating, keep talking to people, because you never know, and people will start telling you things if you're really honest with them and you talk to them as a person and not always trying to, quote, sell them something. Because we're not trying to sell anything. We're trying to get partners. We're trying to get people to get on board with us as partners. And I think that message has an emotional connection. Donors, you get those connections going, and Linda can tell you, those people start telling you things they haven't even told their families.
Right.
So it becomes a very tight relationship. You don't do anything, of course, to violate any confidences with them. You keep things close as you should, that kind of thing. But I think go to your database, go to your donor records, and okay, you got 100 names in front of you. Who are the 5 people you need to call today? And what's your message going to be? There's planning involved. You plan these calls based on that individual's circumstance. And then as you talk and have conversation with them, you learn more even than you knew before, always. And that guides you in terms of your next steps, your next, what we call moves.
Great. I want to pivot one more time. I appreciate the time that both of you are sharing with our listeners. I think, Linda, you opened up and we're talking about the important role that Meharry is playing right now in the pandemic. And I realized some of our listeners may not know who Meharry Medical College is or what your role is and why it's so important, the work that Meharry does since inception, but most specifically now and going forward. Could you share a couple words with us?
Sure. Meharry has been around, as I indicated, since 1876. We're one of 4 historically Black healthcare institutions, along with Howard University, Morehouse School of Medicine, and Drew, which is now part of the UCLA family. But Meharry is the oldest predominantly academic health science center in the nation. We train physicians, dentists. We also have a School of Graduate Studies, MSPH program, MSPH and PhD programs. We have dual majors where some physicians also get a PhD, so they have a double major. And we also now have a Robert Wood Johnson Health Policy Center. So Meharry is multifaceted. We are blessed in that we have a president, Dr. James E.K. Hildreth, who is a world-renowned researcher. He has spent over 40 years of his career dealing with HIV/AIDS virus. And so this is just something that we have been blessed to have, this type caliber person who knows about viruses and is able to talk about things that we need to do as a community in trying to eliminate this pandemic. He's on a lot of, he's getting all type of press because of his knowledge base. And so we are blessed. And then Meharry has one of the testing centers on our campus. We were open Monday, Wednesdays, and Fridays. This week, we're now open every day. So there are 3 assessment centers in Nashville, and Meharry is one of those centers. And we work in partnership with the government here, the Metro Mayor's office and the health department here. And so Dr. Hildreth has a wealth of knowledge that he imparts on this community and nationwide. He's been on a lot of interviews and really sharing best practices of how we need to manage and how we is safe at home and the testing and we also have a researcher here, Dr. Alcindor, who is actually working to try to help come up with some type of vaccine for this pandemic. So Meharry, as I indicated, is on the front lines, not just here in Nashville, but throughout the nation, because I would say over 50% of our physicians practice primary care in the primary care area. So they are all over the nation and they are on the front lines. We have a lot of our younger alumni right now that's dealing with the pandemic. We have a young man that's at Sanford University in emergency medicine. We have a young lady who just is about to go to be chief resident in Tulane. She's been on the front line down in New Orleans. We have a young man in Miami who's going out doing testing for the homeless. So these people, these are Meharrians doing what Meharrians do throughout the nation.
Well, this is great. I really appreciate you sharing that detail and sharing the story. I want to ask you, Bob, do you have any closing comments as we wrap up? Anything you want to leave our listeners with?
No, I would just add, I would just illuminate what Linda said and say, you know, Meharry, but also all organizations that are really doing good work now, highlight that and feature that to your donors and to the public. I think Meharry's done an excellent job doing that because you're current with today's challenges. And so whether you're a small college in rural, state somewhere that people don't know it, you have a mission that people will relate to. And whatever that mission happens to be, go back to your mission and really focus on what work you're doing with your students or your clients or your colleagues and constituents to let them know that you're in the fight, whatever that fight may be, and let your donors know that. Because if they don't know, they can't respond.
Well, this is great. Thank you for those words. And as we close, I think I would be negligent if I didn't say, if you're listening and you want to give to Meharry, you certainly should. You can go to their webpage. We're also going to post information below with a direct link to Linda if you'd like to start a relationship with the college. If any of your family members have attended the college, however extended that might be. I think this is a time to say thank you. And I think importantly to say thank you to consistent Black leadership at all levels. Black people who are committed to our country, to our nation, and to our community. Having this lens right now at a time when COVID-19 is disproportionately impacting Black Americans of all races, all classes, all economic levels, the impact is disparate. And so to have a medical institution that's focused on bringing Black leadership to the medical field and serving the Black community, it's needed more than ever. Needless to say, I lift you two up as some of the consummate fundraisers that I know. If you're not yet a fundraiser, look at these two and think about what your future might be. I thank you all for joining us for Fundraising Good Times. We'll see you again. Until then, be safe.
Take care. Bye-bye.